Okay, so hello everyone, and you are very welcome to this webinar. Briefly, before I do anything, I'm going to address some of the techie stuff, just to make sure that we all know how this is going to work. So the very first thing I have on screen here is the contact details of my colleague Femi. So if at any point during the webinar you have any issues, technical issues, please text Femi at that number there. It's 086 318 3512. So text rather than call, and he can help you out. I'll show that number again now in a moment, but just to show you as well what you should be seeing. On your screen, you should see this interface here. You should see the slides on the left and a kind of control panel on the right. So just to show you then how to use that, you'll see that there is, here you can see that there on your control panel, there's a little kind of dark kind of little button section, and there's two red buttons. You can ignore those, we control them, but there's also a little white button with a square in it, and that opens up the comment box. So that's very important. If you have any questions or comments during the webinar, please note that this is a listen only webinar. So if you have questions and comments during the webinar, please type them into the box and we will address them at the end during the questions and answers section. So if you want, you can just test that out now. So please go to your questions and comments box, press that button there and type in and let me know if you can hear me. So maybe you can just let me know if you can hear me loud and clear just by typing in yes there. Okay, so while you're doing that, I'll just explain the other kind of icon, which is a little kind of hand wave icon. We probably won't use that during this just this webinar, but just to be aware that it's there. If you need to vote or if people need to agree to something, they can use the kind of hand up sign. Okay, so let me see, can I see if there's any? Yeah, so we've got one comment anyway that yes, you can hear me. Excellent. So if you can hear me but you can't see me, the issue is probably that the viewer window is minimized or hidden on your desktop. Okay, so how you would fix this is you just make sure any of the other windows are closed on your desktop, and if you are using a Windows PC, on the taskbar at the bottom of the screen where all of the icons are, you will see the GoToWebinar icon, which is a little, for Windows, it's a little blue kind of daisy or flower. So you can click on that and the interface should appear. If you're on a Mac, at the dock at the bottom of the screen, it's an orange kind of daisy or flower icon. Okay, and that should open up the interface there. So that's more or less our techie stuff. I'm just going to put up Femi's number again, 086 318 3512. If you have any technical issues, please text him. So, okay, so now that that bit is over, we can get into the actual webinar. So just to say a big welcome to you here again, and thank you so much for taking the time to be here today. Just to note, I could just see a question coming in there. You should be able to see the slides, not me. So you should see COVID-19 community outreach community champion briefing on your screen there. Okay, so perfect. So just again to welcome you and say thank you so much for being here today on relatively short notice and making the time. I'm delighted to have members of our community of champions who are responding to our call, but I also have my colleagues here from the Wheel and our partners from Irish Rural Link, as well as Paul Garrity, who's here from the Department of Rural and Community Development, who are funding this project. So a very big thank you to them for being here today. So just to explain what the goal of the session is, it's designed to help prepare people to take on the role of COVID-19 community outreach champion in their areas. By the end of it, we will cover how to develop a local outreach plan, access and disseminate accurate information, recruit local stakeholders, and implement the programme in a local area. So the first thing I'm going to do is hand over to the two CEOs of the Wheel and Irish Rural Link to just give some background of the project. So the first person I'll go to is Deirdre Garvey, CEO of the Wheel. So Deirdre, over to you.
Thank you very much, Emma. And can I reiterate your welcome and hello and greetings to everybody who's on this webinar. It's both a very challenging time for the country and for us all in our family and personal lives, and also professionally. But at the same time, as an occasion like this, it's also a very exciting time as we are all getting involved in developing this community outreach program for the first time in relation to this particular challenge and national emergency. So what I wanted to do is just give a brief few minutes overview of the project and describe the Wheel's role. So this project is a community outreach program. It is being funded by the Department of Rural and Community Development. It finds form, I guess, the reason for it is that, rolling backwards a little bit, is that in light of the national emergency, the government has produced a government national action plan for COVID-19, and that was published on the 16th of March. About 8 days later, as part of that plan, a community response series of measures was announced in that original plan, and the responsibility then moved to the Department of Rural and Community Development to further develop what that might look like. So the department, and I know Paul is listening, department have engaged on a range of different fronts, and it's not for me to go and talk about all of those different fronts. This programme with the Wheel and Irish Rural Link is the one we're talking to here today, and all of the different projects and programmes that they have funded as part of this COVID-19 response will be coordinated, and we will expect a large amount of coordination across the different programmes. So this is a project that we have done twice before in very different circumstances. The Wheel in association with Irish Rural Link. We ran a community outreach programme in 2012 in relation to the switchover of analogue television into digital, and then again in 2015. And some of you on this call were involved as our champions back then. From the Wheel's perspective, we're the project, I guess, the lead partners in the consortium, only in the sense that we have the contract and the arrangement with the Department of Rural and Community Development. Other than that, we are equal partners in all things. And we have a sort of division of labour whereby the Wheel is looking after the project management and the supports and the resources and the engagement and the website and all of the things that will enable the champions when they get appointed to do their work. And I'll let Seamus talk about the role of IRL, which will be very much a hands-on role with the coordinators and with the champions. So, and again, these things are not clear-cut because it's an evolving project in an extraordinary time. It's been done fast. The last time we did this, it was a question of 2 months planning, and we've done that in 8 days now. So I just want to say thank you to my colleagues. I also just want to finish up by saying this is really one formal phase of the programme, having this briefing. It may well be that some of you are here standing in for other colleagues who can't be here. It may well be that some of you, for whatever reason, won't or aren't in a position to actually be appointed champions after this, and in which case we'd let you know. And it may be that some of you are here, I guess, employed in organisations that will be part of the programme but won't necessarily be the main champion. So that phase moves on after this briefing and moving to tie down precisely who the champions are and moving into precise arrangements. So with that in mind, I'll say thank you very much. Wish you all luck. I'll be engaging with you a lot, I'm sure, over the coming weeks. And I'm going to hand on now to Seamus Boland, who's the CEO of Irish Rural Link.
Irish Rural Link. Can you hear me, everybody? I hope you can. New technology, because that's the way we're trying to do it. We're trying to do the technology meetings, which are a challenge in these times, like a lot of other challenges. Irish Rural Link are happy to be involved in this program along with Wheel, and we have the experience of the previous two programs in which to draw on. We also have the experience of you. Many of you have been in this before, and you have got a fair amount of experience. But this is different. It is challenging, and we're going to learn a lot more about Your role, in a nutshell, is to effectively reach every townland in the county that you're in terms of, are there volunteers working in the area, delivering messages, groceries, whatever it takes to help and assist families, people living alone, couples who are isolated, who have to be isolated in order to ensure that their lives are saved, because that's what this program, like everything else that's being done, it's about saving lives. So in that sense, your job will be in many ways to make sure that those who are already doing the work are doing it with great support. You're liaising with the state bodies, including the the HSC and the others, and you are filling in the gaps by going to organizations who may not be in the area that's without help, but could find people who are. Other thing you do is make sure that every single person approached or approaching a person who needs help is known to the person. And I think that's the uniqueness about this program. I really do thank you for stepping up to the mark. Some of you are quite frankly, I'm getting messages that are not being heard, and I don't know why that is. Can somebody come back in, or can anybody hear me? I'm getting messages I'm not being heard.
Can you hear me?
Yeah, I can hear you. Am I being heard?
You're breaking up a little bit, but we can hear a little bit of what you're saying.
Oh, sorry.
That's okay, no worries.
Okay, apologies if you didn't hear what I just said, but just to quickly capture, the role in this project is to reach every townland in the county and to make sure that anybody who needs help is getting help. You don't have to give the help yourself, but you do have to find out people, because you have the contacts who can help, whether it's the GA, the IFA, the ICA, youth groups, women's groups, community development groups, whoever can do it will do it, and working with the volunteer centres and every other people who can provide help. That's the job, because it's about saving lives. The reason you're here, of course, you were with many of you before, but equally you have contact to reach, and this will be the challenge. Each person in their own county, and some counties too, will be hopefully working together to make sure that they actually do the work. So look, I don't know how well I'm being heard of. Just to say thank you. Lincoln will give you support, and luck with the whole program.
Great, thank you, Seamus. Okay, I think we got that last bit there, so that's great. Thank you very much, Seamus. So just to go over the agenda, so just we've covered the welcome and introduction. We're going to give a quick overview of what the program, the project itself is. We're going to look at the role of community champion and what does that involve. We're going to look at the resources that are available and what's coming soon. We look at the reporting, at guidelines for dealing with the media, and we'll have a section at the end for Q&A. So as I said, just put in any questions that you have and we will address them at the end. I did see one question come in about whether there'll be a listen back available for this webinar. Absolutely, we are recording the webinar, so it'll be, don't feel like you have to remember absolutely everything. You'll receive the slides and there will be a recording of the webinar for you to access at a later date if necessary. So with that, I'm going to hand over to my colleague Lauren to do the overview of the project.
Hi everybody, bear with me while I share my screen. Hopefully you can see that and you can hear me okay. Let me see. Okay, great. Thanks a million, Emma and Seamus and Deirdre. So my name is Lauren Carroll. I work with the Wheel, and I'll be working alongside Emma and Maria in the project management of this project for the next weeks, months, however long it takes. And I'll be one of your contact points, so we will be in touch. So over the next few slides, I just hope to take you through an overview of the COVID-19 Community Outreach Programme. There will be a lot of information, and as Emma said, we are recording and you will get the slides afterwards. The comment box is there for questions. I'm hoping we'll cover a lot of the questions that you might have in mind already, but do pop them in, because if you have it, I'm sure someone else has the same question. And then it just goes without saying that myself, Maria and Emma will be on hand throughout the entire programme, so you will be well supported throughout. Bear with me, I see I'm on the wrong slide, so I'll go backwards. Great, so we'll start here. So just a little bit of background on this. So at this point, it's just really important for me to let you all know that any of the information we've sourced on COVID-19 comes from the likes of the HSE, the Department of Health, the World Health Organization, so all just reliable central sources. So I guess this project is a response to the crisis. As we know, COVID-19 is a brand new illness. It can affect your lungs and your airways, and it's caused by a virus, the coronavirus. The symptoms of COVID-19 are a cough, and that can be a cough that is dry or wet, so of any description, shortness of breath, breathing difficulties, a fever or chills, and these symptoms can take 14 days to appear. So we know now that COVID-19 has been officially classified a pandemic, and I suppose across the world we've seen different measures being put in place, but in Ireland that has been school closures, university closures, closures of other public places and spaces, and ourselves we're restricting our movements and practicing good social distancing. So you probably saw on St. Patrick's Day the Taoiseach's address, where he told us that there may be up to 15,000 cases by the end of this month. And what he called for was solidarity in this time of national crisis. So I guess it reflects the purpose of this project really well. Yeah, so COVID-19 obviously is very contagious, and it is most dangerous for vulnerable groups. And these vulnerable groups are those over 60, particularly those over 75, and those with long-term medical conditions and those with a weak immune system. We will take a look at our target groups in a little bit more detail in a few slides' time. So we'll check back in on that. So I suppose moving on to what's happening now. We know that things are developing very quickly, things are changing daily, if not hourly at this rate, and the virus is very new. So this causes citizens to look for answers and to look for reassurances. But this is putting pressure, I guess, on public services, and public services are being overwhelmed by anxious callers with their queries and that type of thing. So I suppose the system needs to get clear and factual information out to citizens in an efficient and timely manner, and it needs to stem panic, and it wants to eliminate any misinformation is out there, and it wants to empower communities to be able to support one another, and particularly those vulnerable groups. And that's really where you come in, so in your role as a community champion. And what's our response here? So what we're doing is creating a network of knowledgeable people, and that's you. And I suppose your role is going to be to disseminate information to community leaders, and they will then in turn mobilize others in their communities. So that's volunteers and networks that we're familiar with, and they'll keep them informed with factual information and advice and best practice from government. And by doing this, we hope then to counteract any misinformation out there about COVID-19. And what's important to say is that this network of you with your experience in your communities is built on trust. So we want to deploy members of this network who are familiar faces, trusted faces from within the community. And we want the network to be empowered with knowledge direct from government. So you'll be able to signpost to relevant services, not necessarily fill in those frontline services, as Seamus mentioned at the start. It's to signpost. It's to monitor the situation on the ground and then ensure vulnerable people are supported. They know that there's someone there to support them, and you can take on feedback for what is actually happening in your area and feed that through to ourselves, the coordinators, so Irish Rural Link and the Wheel, and in turn we'll be able to communicate that to government. Okay. So just moving on now to have a look in a bit more detail of our who we're trying to reach. So you'll see there's 3 different types of profiles here. So we have Maria in the first box, and a little bit about Maria. She's elderly and she's living alone. She's vulnerable and she does need support every day with you know, general tasks like going to the shops for her groceries or being able to collect her prescriptions from the pharmacy. Then we have Emma, and Emma has a long-term medical condition which makes her vulnerable, and her family are trying to protect her by limiting their contact with people outside of the home. So they too will need basic supports delivered to their door while avoiding this contact with the public. And then there's Seamus. So Seamus lives independently, but he is supported by carers. And Seamus may become vulnerable if his carers have to self-isolate and they can't attend to his needs. So, you know, we just want to be sure that there are supports in place to be able to plug that hole if something like that does happen to happen in your community. Now, there's a lot of information here and we're moving quite quickly through it, but there will be time at the end for questions and answers, so do record them in the comment box as we go along. What you're seeing on your screen now is information flow. So what's important to say is information not only moves from the top down, but the bottom up, and there's a constant feedback loop. So the channel of communication is open all the time, the whole way around. So what we're looking for is facts and, you know, accurate information and advice on best practice from government departments. So in this case, the Department of Rural and Community Development. That will be fed through to the coordinators. So that is the Wheel and IRL. We will then talk to you guys. So as community champions, myself, Emma and Maria from IRL will speak to you, give you this information, and you'll then reach into your communities, as Seamus put it, townland to townland within your county, and you'll link in with those local community groups that you have relationships with. They'll have volunteers and frontline workers and networks within their organisations, and it's these people that will reach the target audience. And the target audience again feeds up, so they will be feeding back, I'm sure, their questions or their concerns, or perhaps a gap in service that can't be addressed locally, and that will flow through the local community groups to you, the community champion, who will report back to the Wheel and IRL, and then we can communicate to the relevant departments. So I'll just let you have a quick look at that slide just for a couple of seconds, but as mentioned, you will get this afterwards, so you can have a closer look in your own time. So I suppose what this allows us to do is it's to hear what's actually going on at community level, to take questions, queries, concerns on board, to be able to get answers to all of those questions and queries and concerns, and filter the information back down to lots and lots of communities around the country. And I guess that relieves pressure on systems, so that relieves people in communities maybe asking the same questions over and over and the same answers being given. So the idea is that we can get an answer once and we can filter that out. And this feedback loop, or this information flow, it also allows us to map the needs across the country and, you know, disseminate the facts, the accurate information, the best practice, and then deploy supports where needed and if needed. Moving on for the information, what do we want to do? So first and foremost, we want to make sure that our target groups, so our examples of Maria and Emma and Seamus, are central to this project. So we build our work around them and what will work for them. So it's client-centered, for want of a better expression. Cascade model, what does this mean? So this means that accurate information will be filtered down from the community champion to your network of local community groups and volunteers, who'll be able to then spread the information out to the people, the vulnerable people that are living in the area. We're using existing trusted networks of familiar people who are known in the local area to our target groups. And we want to be able to respond to meet the needs of your community or the community in question, because we recognize that everyone is different. You know, there's not going to be exactly the same needs nationwide, so we need to be able to be responsive to a variety of needs. But overall, we want to show care and we want to show support at a local level. We want to be able to support vulnerable groups in particular and allow communities to feel empowered, as opposed to be self-reliant, be able to just source factual information and then find solutions to problems in their own areas. And all of that said, what impact do we want to make? So it goes without saying that we want to reassure people in a time of crisis. We want to look after our most vulnerable, make sure they're supported and not forgotten. And we want to be able to disseminate information quickly and efficiently through our channels of communication or information flow. And then we want to be able to relieve pressure on public service systems by answering questions once, but getting information out to many. So I guess that's it from me for the time being. We will be in touch, of course, over the duration of the programme for the rest of the webinar. I'm going to pass you on now to Maria, and Maria is going to give a lot more information to you on the role of the community champion. So thanks for listening, everybody.
So hello everybody. We're going to take a look now at the role of the community champion. So the role of the community champion will be disseminate accurate information. I mean by quickly and efficiently through your community leaders network and your key volunteers to groups working on the ground, fielding questions, queries and feedback from the ground up through the system. You will mobilise community support by working closely with community leaders to mobilise supports on the ground by sharing best practice advice shared from around the country and, of course, from other champions. Identify and report gaps. Where gaps in the services are identified, report back to the national coordinators. Connect with other community supports. For example, community coordinators from the 27 HSE hubs, like to ensure services are available for people who are discharged by contacting and notifying voluntary groups and local organisations in that area. Other organisations, there would be Meals on Wheels, Transport and Gardaí. They may also become your key volunteers. Support volunteers and community members. Feed the volunteers and community members accurate information, direct them to each other, and they will disseminate information for you and give feedback. So we have identified 7 implementation steps for the community champion to follow. Step 1 will be develop a local outreach plan, and we'll go through that in more detail in a couple of minutes. Step 2, review key information sources. Step 3, update local contact work. Excuse me. Update your local contact network. Step 4, recruit local organisations and volunteers. Step 5, conduct briefings regularly. Step 6, promote COVID-19 messaging as needed. And step 7, ensure programme is implemented locally. So if we look at step 1, develop your local outreach plan. So develop a clear plan, setting out your aims, objectives, targets, strategies and actions. And I think we have a sample of a plan for you to screenshot there on the system. Anyway, this form should be targeted to your specific area. So to start off, you will name your area, your county, name the champion, name the contracted organisation, the total population, is the main urban centres and the estimated population in the target group. Now we'll provide that template to you. Step 2, familiarise yourself with the main sources of information and key messages. So familiarise yourself with information on COVID-19 provided to you by the National Coordinating Team or statutory sources locally. So use only information supplied by the National Coordinating Team or local statutory sources, for example, the HSE or Citizens Advice. We will also be providing a web page full of up-to-date sources and FAQs, but we'll come back to that later in the presentation. Step 3, update your own network and database of organisations operating locally. So include organisations already responding to COVID-19, such as organisations on the ground, the Meals on Wheels, the GAA, the Gardaí, the Rural Transport Associations, the Men's Sheds, along with the statutory organisations. To include those that directly support vulnerable people, so groups that support older people and people with underlying health conditions, such as community services councils and volunteers networks. Irish Rural Link and the Wheel will also provide relevant contacts for your county from our own databases. We'll provide that for you. Step 4, identify community leaders, recruit local organisations and volunteers. These will be your key volunteers. They will disseminate accurate information to the target group and feed information back through the community champion. Community groups then can recruit local army of volunteers to help with identified tasks such as shopping, meal delivery, befriending, telephone support. You just make sure that they are all in your network. We will also supply practical materials to support the identification of tasks for these volunteers. Step 5, provide clear and concise briefings to local organisations and volunteers. So use phone and online platforms to provide regular briefings, and these could be on a daily basis depending on how things are moving along the situation. Observe the official advice from the government regarding social distancing and self-quarantine and self-isolation for yourself. So use the online, emails, phone or online platforms. Include protocols for community groups and volunteers delivering services. So IRL have produced a protocol document and we will share that also with you. You are there to direct people to the relevant supports available locally and regionally, and you are not a medical expert or able to offer professional advice. So reaching the most vulnerable in this crisis is something only local knowledge can do. So this is where your key volunteers come in. You want them to take responsibility for individual areas, parishes, and use their contacts to try and identify households and individuals that may need help. You want them also to be able to answer basic community support questions on COVID-19 that is accurate, and you are there to direct them. We will also maintain an up-to-date list of FAQs to assist you in this. Step 7. Ensure overall implementation of the programme. I think actually I might have jumped one there. I'll go back to step 6. Support the wider promotion of key messaging around COVID-19 as required. So as the key messages come out, we will feed them down to you, and in turn you will feed them to the local organisations and to the operations on the ground. And we'll keep you updated probably on a daily basis as this carries on. So step 7 then, ensure overall implementation of the programme in your area. So you will already have done your outreach plan and your mapping. So monitor progress against your outreach plan. You will be reporting back to the National Coordinating Team on a weekly basis and practice self-care. So look after yourself. If you need assistance, if you need help or support, we will be at the end of the phone for you. Thank you. So I'll hand you back now to Emma.
Okay, so hello again, and thank you for that, Maria. So I'm now going to go through the resources that are available to community champions. and to outline how the reporting and data collection will take place throughout the project. A quick note before I get stuck in is that, as Deirdre I think mentioned at the beginning, this is a very quickly evolving project. We've done our absolute best to build an effective package of supporting resources for you, but it has been a tight time frame, so we'll continue to develop and add supports throughout the project. So we just ask you, I suppose, to bear with us on that, and to let us know what you need as the project unfolds, because that's going to inform how we develop things going forward. Also, another note, I suppose, is just to mention that, you know, we've tried our best to keep the reporting requirements as light as possible, because this is obviously an emergency situation and we don't want people bogged down in paperwork. But we do have to collect some kind of numbers and stats and things like that so that we can report back to the department. So, but we've you know, kept in mind and tried to keep that to a minimum. So just looking at what resources are available. So you can see the community champion role description. This outlines the responsibilities of the community champion, and you might have received a draft of that already. There's also the community champion guide, which outlines even further, I suppose, the role, the implementation steps that Maria went through, the reporting requirements. So I suppose just to reassure you that this webinar, as I said, it is being recorded and it will be a resource for you, for whoever ends up being community champions going forward, but it will also, there's also supporting documents to go along with it. So the champion guide outlines everything that's been covered in this webinar today. Just to note, I suppose, as I mentioned, it is an evolving project, so this is subject to change, and we will be keeping the most updated versions of everything on our Community Champion webpage, which I will show you now in a moment. So just to bear that in mind, and keep checking in for the most recent versions of everything. We've also got phone support for our champions. So Maria at IRL is your kind of main contact point. She was very much involved in both the air codes and the switchover projects, so she's kind of an old hand at these types of things. So she's a great kind of contact and support person for you to have there, and her number is there. As I mentioned, you will get these slides, so please don't feel like you have to write down all these numbers. They will be in the slides when you receive them later. So, but that's her phone number there, and she's there to provide questions, advice, any kind of implementation issues that you might run into. Maria is there to support you. We've also built kind of a purpose COVID-19 email address at the Wheel, so c19@wheel.ie, and this is there for you to kind of log any issues, concerns, questions or anything like that that you have maybe while you're out on the ground. You can just send them to that email address, and we will have, some of my colleagues will be monitoring that and collating all the feedback that's coming back and logging it and making sure that we're keeping kind of an accurate track record, so that when we do go back to government to look for answers and for clarification on issues, that we have all that information there. So that email address is available to you to just log anything that might come up. So we also have, I think was mentioned already, maybe by Lauren and Maria, was the FAQs. So at the moment, this is just based, it exists on our webpage, which, as I said, I'll show you now shortly. But it's just based on our own research, and it's into, I suppose, the common questions that are arising in relation to the crisis. And really the purpose of it now is just to create kind of a one-stop shop, so that you don't have to go to, you know, the HSE, Citizens Advice, you know, several different websites, that it's all there in one easy to reach area for our champions. But as the project unfolds, we kind of, this is where we intend to house the answers to the questions that are coming to you that are coming to us from the champions. So when they send us questions, we will look for answers from the relevant government department and then update the FAQs, so that you all have access to that answer at once, because we're anticipating that the same answers will be coming from communities around, or the same questions, I should say, will be coming from communities around Ireland. So this will be a way of trying to capture that and get the answers and filter it down as efficiently and as quickly as possible, without the HSE, for example, having to answer every single one. So we're ensuring that the right information gets to people as efficiently as possible. So we're anticipating that as the project evolves, this FAQ section will become a really vital source. Okay, so the next thing then is coming soon. So as I said, this is evolving. So we're trying to produce, these are our next immediate steps, I suppose. So we will have a map of community champions, which will be on the webpage. So that will allow you to link in with each other if that's something that would be helpful for you. And it also allows people to find their local community champion if they need to. There'll be an audit of existing COVID-19 community initiatives. So this will be something that you will be doing yourselves as part of the, I suppose, local outreach plan, kind of mapping what's already happening in your area. But we will also look at maybe some national initiatives and some of the major initiatives going on a county by county basis, and we will provide that as a kind of support to you in the coming days or in maybe next week. We'll also have a WhatsApp group for all of our champions, which will be facilitated by IRL, so you can log questions and hopefully support each other there. And then more resources as needs arise. As I mentioned, we want to hear from you what you need so that we can try our best to meet that. So we anticipate that we'll be getting feedback from you and trying to react as soon as possible. So just to give you, this is just a screenshot of your web page that is coming. So it's being updated today. As I said, this has been a really tight time frame, so bear with us. But you will be receiving a link to this community champion page probably today or early tomorrow, which will include all of the resources that we've gone through today, including the guidebook, and it'll be also where we will house our webinar as well, the recording of our webinar. So this will be kind of your one-stop shop for everything COVID-19 community outreach. So just finally then, I suppose everybody's favorite bit, which is the reporting. As I said, we've tried to keep this as simple as possible. We are going to send a very simple Microsoft form. So this is how we're going to collect the information. So you will receive a link once a week. You don't need to sign in or anything. You just click the link and the screenshot you can see there, the form will pop up, and we'll ask you to log any new data as it comes into this form. So we hope that this will be a really easy way to collect the information that we need to be able to measure whether our project is being as effective as possible. The metrics that we are going to measure against are the number of local organisations mobilised, number of volunteers involved, then the number of key volunteers, I suppose, that are really driving the programme, the number of the target group reach, so that's who Lauren spoke about, the Marias and the Emmas and the Seamuses, the vulnerable people that we're targeting, but then also then the wider community, so the number of other people reached. There will be the number of supports given, the types of supports that are given, and the identified gaps in the supports available. So again, this will be another opportunity to feedback. If gaps are appearing at a community level, absolutely reach out, tell Maria, log it with us at that email address, c19@wheel.ie, but you can also feedback through the weekly data collection forms. So that's what we are measuring. And then finally, just communications. So just to note that there may be interest from local media or national media in your work. So just that any media queries that you get must be directed towards the Wheel or Irish Royal Link as soon as possible. Absolutely be courteous and helpful to the journalists, but just note down contact details and send them to Gert Ackerman at the Wheel, and his mobile number is there. Or Louise Lennon at Irish Royal Link, and again the mobile number is there, and you will have that in the follow-up slides. So just to be aware that that's how that will work, and the community, occasionally we may ask community champions to do some local media interviews to kind of spread awareness of the project. So I think, yeah, that leaves, I think we've got plenty of time now for questions and answers, and I'm handing over to Maria, who's going to lead this part as the most experienced member of the project management team. So Maria, I'll hand over to you. If any questions come in, we can have a look at that question box there, and you can direct us on who's to answer them. So thank you, and over to Maria.
Oh, thank you, Emma. We'll have a look at some questions. Okay, I'm going to start at the top. Just bear with me. Okay, so that's, can I hear you? Can I hear you? Lots of those. Okay, So I've had a query here from Mary Lawler, and she's asking us to please advise who is participating in the webinar. So I suppose I will take that question. The participants in the webinar are the 27, 28 potential community outreach champions, or the organisation's representative who is sitting in their place. Also at the webinar are the National Coordination Team, which are members from Irish Royal Link and the Wheel. Paul Geraghty is also here from the Department of Rural and Community Development. And I think that's it, Mary. So will the webinar be recorded for us to listen back? That's from Gloria Callan. And yes, Gloria, it will be. Slides and recordings will be sent to you later. Okay, I'll go down. Okay, sorry, now I'm just going through these questions. So it was very difficult to hear Seamus at some stages through that. Lots of you have commented there. And all I can say is because it's been recorded and copies of the presentations will be sent to you, hopefully you will be able to patch up what Seamus was saying from those documents. Okay. Conor O'Leary. What is our level of responsibility, in particular in the context of PPNs and volunteer centres, as stated in the national plan? So I think I will hand that over there to Deirdre.
Very much. I'm just confirming that I can be heard. Would that be right? Can you hear me, Maria?
Yes, perfectly. Thank you.
Great. Thank you very much. In terms of the level of responsibility, is that there's a lot of existing infrastructure that's there at local level. You've mentioned two of them, PPNs, the volunteer centres, as just two. And I remember I mentioned at the very beginning of the webinar, there are 4 programs in the community response initiative being worked on by the Department of Rural and Community Development. One of them is our one here. One of them is an enhanced local volunteer centres programme. One of them is the department itself working in with the PPN. There'll be another programme with Alone, the older persons organisations, and another one with Senior Alert. So, and we also have, and some of you actually are associated with them, the local development companies at local level. And one of the other speakers spoke about the other infrastructure. I think it was Seamus, the GAA, the Farmers Association, all of the myriad, I guess, community-based, local-based organisations that are there in the townlands and in the parishes and in the counties of the country. So all of that is by means of a context. The local champion will be expected to reach out, liaise with all of these groups and many more besides, and through those groups let them know that the champion is there, and let them know to identify townland by townland each series of, I guess, potentially vulnerable households, so that they can be, I guess, identified. And the champion then is in a coordinating signposting role, rather than having responsibility for taking on any of the responsibilities that are being carried out by the PPNs and the volunteer centres and others. To let you know, we are having a briefing meeting on Thursday with the national representatives of all of these networks and others besides, to inform them of the programme, to help them identify what they can do to participate. And they will be asked by the department and indeed by us to push down the information from national level into all of those branch and local structures, so that when your phone calls start coming in, they'll already know, and vice versa. So they'll understand that the function here is to add value to what they're doing and to connect the dots and to signpost, and not to take on any of the work that they're already doing. And I'm going to finish there, because I'm suspecting that Seamus might have, if his microphone and his Wi-Fi are up to communicating clearly, I might, Maria, if that's okay with you, ask Seamus maybe to add in, because this is a situation that is evolving. and we will be, in one sense, relying on the champions to identify for us and with us how best to add value. But the idea is that we will add value and not replicate.
Okay, Seamus, would you like to add something?
I think he might not be available. Maria, we'll move on maybe.
Okay.
If that
We'll
answers.
move on then. Is he there? Okay,
Now,
so
can
we'll
you
move
hear me
on.
now?
Oh yeah, perfect, Seamus. Do you want to come in there?
Yeah, no,
Have you anything to
actually,
add?
yeah, just briefly, Deirdre answered the question fairly well in the terms of the way we're working. Various organizations, whether it's the PPN, whether it's the GA, whether it's whoever, should be involved in this area in their own way. Our job is not to interfere with them, but to support them. So you would be, if you, for example, you needed help in a particular area, and you can't find it, you might just get someone in the PPN, they might know an organization in that area. Your job is not to either duplicate or replicate or in any way interfere with the work done by existing volunteers.
Okay, Seamus, thank you. Thank you for that. So we have another question, and it's from Francis McCarran. And Francis is asking, how are volunteers insured? There are some issues at different levels, different county levels, where volunteers are or are not insured by the HSE to carry out volunteer work. So I might ask Emma just to answer that query on how are volunteers insured in this project.
Yeah, thanks, Maria. I think that is part of the evolving circumstances that we have to clarify. There is insurance terms in the contract, which will be circulated later on this week to the finalised community champions. So there will be more information on that coming soon. But I suppose the answer is now that there is no specific answer. Deirdre, unless you want to put in something, I think that'll be something we'll have to clarify at a later date. Deirdre.
Well, your answer, just to augment by the fact that the volunteers and the organisations that the champions will be liaising with are already engaged and involved with organisations. So, but that was the only thing that they won't. So I'll just leave it at that.
Yeah. Okay. Thanks, Maria. Sorry.
Okay, thank you. So Conor O'Leary is back with another comment, I suppose, and we can agree with him here. So also our role will be to deal with community contacts and volunteers, and they ultimately deal with the target group, as opposed to us being responsible for speaking directly to the target group. So that's exactly right, Conor. The champion's role is to deal with the community leaders and the key volunteers at the top of just above the local groups and communities that are working on the ground. So they will pass the message down. It's the organisations and groups that are already providing services for our target group and individuals. They will actually make the reach with our target group. Thanks, Conor. Conor again asks, how do we avoid duplication with other agencies and also at a local level? So Emma, I might put that back to you again.
Yeah, I suppose that's part of the initial, the first implementation step is I would start by doing a full, and we're going to support you by doing a full audit of what is actually happening at a local level, and that's what we're hoping that our community champions can do to ensure that it's not being duplicated at the community level. So they will be linking in, obviously in a safe way, using Zoom or Skype or whatever, with what's going on locally, mapping it all out, communicating with all those people, making sure they have the right contacts with everybody, so that they're all on the same page. What are you doing? What are you doing? Let's make sure we're not duplicating. Let's make sure we're not stepping on each other's toes. So that, I think, will be a big piece of work at the beginning, is just trying to get a full picture of what is happening in your area. How do I gather all that? Who are the people I need to be talking to? How do I get to them and make sure that we're all communicating, signposting and linking in and joining up the dots, as opposed to working alongside and duplicating. So that's not a quick and easy answer to that question, but it is the first and probably one of the most major steps in the whole process will be that piece of work.
Okay, thanks, Emma. Okay, so Conor, just another little comment there about county PPNs that are already mapping or listing community initiatives. So would we plausibly partner with them and share information with them on initiatives as appropriate? Absolutely. You want to work with all of the organisations who are sharing information. You share accurate information with the PPNs and they will circulate it for you. Tara has asked, have you a particular format for publicising on social media? So again, I'm going to go back to Emma.
That's also a good question. As I said, this is very much an evolving project. It did come up before and we will have guidance about that, but it is, and we've got a policy here of having guidance documents of a page or less, because just to try and make it as quick and easy for people as possible. But that will be guidance that will come down the line about how do you communicate it and disseminate it online. So I'll make a note of it and it'll be added to the list of resources as soon as possible. Okay, Maria.
Thank you, Emma. So I have another question from Grania Beryl. So the question is, a lot of community groups are already contacted by a number of services, would have a slight concern that this might add to the noise of information they're receiving. National messaging is asking vulnerable people to contact the guards. So again, would have concern about mixed messaging. Here, we are already communicating and referring people to the Gardaí for supports. What insurance protection is there for these volunteers? Can we have multiple community champions in an organisation? So I suppose, actually, I might answer that. So Grania, start at, can you have multiple community champions within an organisation? Absolutely. We'll have one champion coordinating everything, and your other champions then will be your key personnel that will get that message out on your behalf. As for the noise on multiple messaging from various organisations, I might just send that back to Emma.
Yeah, I suppose this comes back again to the role is that absolutely this project is a response to the fact that there is a lot of noise and there's way too much going on out there and there's nobody who's tying it all together at a local level to make sure that people aren't overwhelmed and that there is a single person that they can reach out to for, you know, or a single kind of trusted and familiar place that they can reach out to for accurate information, because that accurate information has been fed down to them from the community champion. So I suppose the idea is that, like I said, that mapping exercise in the beginning, looking at everything that's involved, that's available locally, including the Gardaí, including, I think we mentioned HSE hubs, including Meals on Wheels and local volunteers. It's mapping all of that, which will be a big piece of work, and ensuring that you're tying it all together and making sure that there is, on the ground level, a local friendly face that particularly our vulnerable group will know and trust, who can advise people on what the best course of action is. And that might be continuing to signpost them to guards or whatever it is. But as this evolves, there might be different questions, there might be things that we won't have anticipated coming up, and having that community champion, that person there who has this knowledge direct from government, who is knowledgeable and can put people in touch and join up all the dots, that's the value of the project. So yeah, absolutely, we don't want to contribute to the noise, we want to try and streamline it and join up all the dots if we can at all.
Thanks, Emma. Okay, so plans. So am I right? This is from Patricia Cassidy in Meath. Am I right in saying that the plan should be completed by the end of the week at the latest? Or do we wait for feedback and just roll on? So I suppose I could go back to Emma.
Yeah, wait for feedback. We have to, there is contracts on the way that we have to discuss. We have to finalize our final kind of grouping of champions and things like that. And we're working with the department very much involved this week just on ironing everything out. So please stand by. If you're doing things locally, obviously continue with your own work, but please stand by on the local outreach plan and we will keep you as updated as we possibly can as things evolve.
Thanks, Emma. And Karen Dolan asks, can you please explain the types of gaps you might envisage, or what do you mean by gaps? So Seamus, I think I'll let you answer that question. Are you there, Seamus?
Yeah, can you
Yeah.
hear me? Yeah. Okay, the gaps are
Yeah.
very simple. And as Emma said, this is about making sure you don't duplicate anything. It may well be that there is an area very remote that the Gardaí are, everybody will be very busy, including the Gardaí, that the Gardaí or the Vincent de Paul or somebody simply can't get to, or somebody hasn't thought of, or is simply an area where there are no live community organizations in place. And yet there are a number of people or households living in that area who are isolating, who can't go out because they're afraid or because they can get the disease. Those are the gaps. They need to be identified as quickly as possible. It will be great, for example, I don't mind if the PPNs and the J and they are all, they're all looking at the one place. That's brilliant. You can uncomplicate that and say, look, one group go in and do it. But there are areas, especially in remote counties, that really will not have anybody. That may be one person living up a long laneway, or an area that just has no community action. They have to be identified, and then you have to try and find somebody in some of the organizations that will take on that laneway.
I'll add to that as well, Maria.
Okay.
Yeah, just to
Go
say
ahead,
as well,
Emma.
it's important to feed back to us as well if something is stopped happening on the ground level. So, for example, if a Meals on Wheels service, or whether it's St Vincent de Paul or whatever usual services would exist for vulnerable people at a ground level, the department wants to know about that if that happens, so that if something needs to be mobilised to address that we can do that. Now the wheel can't guarantee that, but what we can say, or the IRL can't guarantee that, but we can feed that back to government so that if things that would usually have run smoothly are shut down because of the virus, and vulnerable people are now at real risk of not getting their Meals on Wheels or not being able to access community services, that some kind of solution can be gotten to sooner rather than later.
Yeah, and I think that's a good intervention. Also, there may be areas where the only people you can get in there is the army, but that needs to be fed back quickly to the relevant authorities.
Yeah.
Okay. Thank you. Thank you, Seamus. Thank you, Emma. So I have another question or observation really, from Gloria Calnan. Hi there. In Clare, we are already working on a C-19 emergency response with a multi-agency grouping, LCDs, PPNs, volunteer centre, LAs and community groups. Is there any way to ascertain if this is happening in all areas, and how can we share learning? So maybe Deirdre, you might take that.
I'm happy to. I didn't quite catch the county or the area where that was taking place.
This is Gloria Calnan in County Clare.
County Clare. Gloria, I think that's one of the questions that will be answered by the other champions when we set up the WhatsApp group, and we can compare stories or situations. But factually, we know that kind of grouping is being set up and are being established in different areas. So it would be for each local community champion to identify that in their area, to make sure that grouping is aware of the champion's existence and the program's existence, and to bring the benefits of that type of coordination, out into the community where it might not otherwise reach. But if that kind of coordination is sorting an awful lot, leave well enough alone. All you need to be doing as a champion is to be aware of it, and they're aware of you, so that the resource that the community champion brings to the picture can be used where needed. And I guess it's the really core. The most valuable asset of a community champion is their networking abilities and their connections and their curiosity and their problem solving in terms of just getting people to talk to each other, getting the community group to fix that if there is a problem, because they'll know, for example, if that, going back to Emma's example, if the Meals on Wheels falls or drops through because of people are unwell or can't leave the house, well then, if the champion were to find out about that, then they can not deliver it themselves, but actually contact another group who might be able to fill the gap or who might be able to help with volunteers for that particular service. I'm just using that as a micro example.
And Maria, if I may add, community, this is not a time for competitiveness between groups. If a group is doing a good bit of work, then let them do it and let the other group move to somewhere else, because the job as a champion is not to create work either for themselves, necessary work for everyone else. In fact, if you can come back to say that your county is 90% being served, that will really make your job a lot easier. And your job then is to make sure, as I said, the gaps don't materialize. You'll have little to do, and that's the way we want it.
But also you have things that you can maybe share with other places in the country, and that's one of the things about this program. It's that in one sense we're here sort of as the managing partnership here in the Wheel and IRL, but you guys and the champions are on the ground. This program will look different in every townland and every locality. The principle being, you guys are connectors, you're networkers, you're people who know people and how to call them and when to call them, and can solve local issues locally without escalating things that don't need to be escalated, but have the sense to know when to escalate something that does indeed need to go higher up.
Okay, thanks Deirdre and Seamus for that. So Conor O'Leary has asked, have you considered or have advice of the approach to doing this, considering the limitations with remote working? In previous schemes, for example, we went out and made presentations to groups, but clearly that is more limited now. So I suppose I will take this question from Conor. Absolutely, Conor, there won't be any going out and holding events or talking to groups. What we are suggesting for this program is that you use online platforms to contact your groups, to share information and to spread the word. So I suppose you'll be on the phone, you'll be emailing, you will be organising webinars possibly, and hopefully that given the limitations, that you're not too limited as far as, I suppose, broadband is concerned. That's clear now. Okay, Patricia, Gloria. So I'm down to Damien Ahern. So Damien asks, will there be any resources made available to the groups, i.e. gloves, sanitizers, identity cards, etc.? If we are asking groups to report to us, we need to be in a position to support the teams with resources. So I will hand that over to Emma.
Yeah, no, I agree. However, it's not part of this initial project plan, but that can absolutely, like in terms of gloves and sanitizers, I should say, there is a budget available for, I suppose, incidentals or whatever. But there's no specific budget set aside for gloves and sanitizers or how they would be sent or distributed or anything like that. But that is something that has already been considered, as this will come up as an issue. So that would be sort of the first example of something that we might be feeding back to the department. And it might not come through this project, but maybe that's how we signpost it to the department, that such and such down in whatever county needs sanitizing supplies as soon as possible, kind of thing. So this is the kind of information that we need fed back to us. We can't supply it through this project, but we can take note of it, feed it back, and maybe try and signpost to other places who can get you the supplies that you need. And just to say, like, you know, as I said, there's going to be projects that there's going to be questions that we can't answer here, but I am kind of taking note of everything. So consider this the first round of feedback that we are receiving from our champions, that we are noting and feeding back.
Okay, thank you, Emma.
Yeah.
So Tara Farrell states, our understanding is this approximately over 3 days per week, but presume we apply division of time as we see appropriate. Absolutely, Tara. Where we're asking is that champions put in the equivalent of 3 days per week. So you will be dividing your time as you see fit within the organisation. It could be evening work, you know, depending on how you're going to contact your other organisations and your key volunteers. So, Kieran Reid, will there be a national media campaign to promote this initiative, or just local media? So I am going to hand it over to Emma again.
Yeah,
Thanks, Emma.
yeah, no worries. So we have our communications team at the wheel and at IRL have met and have kind of formed a plan about this in the last few days. So as I said, you need to bear with us, it's kind of evolving, but yeah, there is a plan in place that there will be both local, kind of once it's everything's confirmed and launched, that there will be kind of local press releases issued, because we think that will be important for this particular type of project, that there's more local awareness of the champion and who they are and how this project is going to work and what the purpose of it is. But there will also be some kind of national stuff as well, press releases and things like that. So, and we have lots of ideas about how we can maybe try and use social media to spread the ideas. And somebody earlier on asked about guidelines on publicising on social media. So like I said then, this has all been thought of and it is going to happen in the coming days. So we will be collecting all of that, and we'll be updating you as soon as possible about it. And hopefully we can all work together to make sure that this is there's awareness of it at a national level and at local level. Okay, sorry.
Can I come in there, Emma,
Yeah.
as well? Thank you. Basically, the government, as we know today, has had a cabinet meeting and is still evolving their own plans in relation to their approach. And indeed, so there are other actors in here that will decide the scope and scale of a national campaign and what elements it will have in terms of this programme being an element of it or not. So that is out of our hands in terms of this briefing here today, and that situation will probably clarify over the next few days in terms of what their plans are indeed. And that's why we're doing this briefing today. You know, there's a bit of breathing space tomorrow. We're doing a briefing of, let's call them a relatively key number of stakeholders. I mentioned before, like national organisations with branch structures and other partner organisations. We're doing that on Thursday, and on Thursday we would hope also to send out mail shots to the Irish Rural Link database and the Wheels database, and indeed asking, you know, the PPNs and these branch structures to cascade it down through their organisations. So in one sense, that's us, not media work, it's not publicity work, but it's us actually commencing letting people understand that there is a community champion in these areas, and if they and they'll be starting, you will be starting to do your work. So I hope that just sort of augments that question a little bit.
Yeah.
Oh, thank you, Deirdre. Thank you, Emma. So Billy Murphy fielded a question, and the question really relates to Paul, and it's so what we'll do, because Paul doesn't have audio or he doesn't have microphone here in this seminar. So what we'll do is we'll forward the question on to Paul later, and we'll come back to you with a response.
In fairness, just to
thanks for that,
you not be aware of this, Maria, but Paul has told me he's had to step out. So just to let you know, he can't even hear the fact that there's a question for him yet, in fairness to him. But
okay, fair enough. So we'll field, I suppose I'll give you the question then that was asked. Can Paul Geraghty recommend to the local development companies that they nominate someone to liaise with the champion in their areas? So that's the question we'll put to Billy.
And I can actually, having spoken, myself and Seamus spoke with Paul just before this meeting, that's the answer to that will be absolutely yes. We will be liaising closely at national level, and that Paul Geraghty, being the person in the department who's responsible for the local development programs. So you can take that almost as a given, but I certainly wouldn't want to put words in Paul's mouth, just to be honest. But that is already on the table for our next catch up with Paul.
Okay, thank you. Thank you, Deirdre. So Gloria Callanan has come in with a comment regarding insurance. She states that the PPN in Clare have said that groups affiliated to them are automatically insured. So thanks for that, Gloria. It's probably the same across the country for anyone that's affiliated to their PPNs will be covered by their insurance. Caroline Wilson, in Mayo, will my plan be for the north or do I include the entire county? Will another champion be appointed as proposed? So I'll take that. So Caroline, as we are sitting here and speaking, your plan will cover the whole of the county of Mayo for the time being. So I would just work on that notion until you're told differently. But currently, there may be plans to expand the champions, but at this moment in time, we don't have that. So I don't know, Deirdre, do you want to add something? I know Mayo is such a large county.
Yeah, no, we have definitely got plans to augment the current cohort, or the first cohort of champions, with additional numbers where needed. But we wanted to get out of the traps with a champion in every county in the first instance. So I guess that's it. To quote my colleague Emma, that would be an evolving situation.
Yeah.
And we'll come back to on that.
Evolving. Thank you, Deirdre. So Kieran Reid asks, will all volunteers recruited to this initiative need to come through the VI for Garda vetting? So that's the volunteers initiative. So Kieran, look at most community organisations will have already done their own Garda vetting. We won't be doing Garda vetting at this level, but yes, I'm assuming everyone that volunteers will have to be Garda vetted. So I'll just put Emma onto that for a second just to add to it.
Yeah, I think, you know, the volunteer centres in each county, they're part of this, and Deirdre can comment more on this, sorry to keep handing the bat, but they are part of this overall project by the department, or the overall kind of strategy by the department. And so they will certainly be stepping up their, I suppose, speed and efficiency when it comes to recruiting, training, vetting volunteers. And so I'm sure they can work with us on that. Deirdre, do you want to add or comment more?
Well, really only to say that we're using the word volunteer, I guess, as a sort of a verb, almost like it's kind of like any human, any person, whether they be employed with a community organisation or whether they be a volunteer with several sporting organisations, whatever. Those people are the people that we're calling volunteers in terms of the community outreach. So in one sense, their insurance is covered in a myriad of different ways wherever they happen to be. And we're using the word volunteer in the sense that that their sense of themselves is that they consider themselves able, willing and ready to, for example, pick up the phone and contact the champion if whatever community group that they're involved in, or sporting club that they're involved in, if they happen to see that there's an evolving gap somewhere in their particular townland, and that they can actually feel themselves empowered as a volunteer, if you know what I mean, even if they're a paid staff person, to work the cascade either to another community group to address that or back up to the champion. So it's in that sense that the word volunteer is cropping up in this programme. Sorry, in which case the issue of Garda vetting in one sense doesn't necessarily arise.
And I would just add that, particularly with the target group that we have in mind, maybe isolated people, older people, vulnerable people, it might well be better if it's their own neighbours, their own friends, informed and steered by community groups and fed with accurate information, who are the ones kind of supporting and offering support. Just it's mainly to ensure that the community at large, I suppose, through the champions first, and then the community voluntary groups, you know, their network of them at a local level, that the whole community is informed and empowered to support one another, including their neighbours, in which case if it's friends, neighbours that are looking out for a vulnerable person, that might not come up as an issue as it would with a stranger who would need to be volunteer vetted. Does that make sense, Maria?
Yes, it does. Perfect sense. Thank you. Okay, so Karen Riley has asked, has a champion or potential champion been identified in each county? And will this be a national rollout? So Karen, I'll answer that. Yes, it is a national rollout. We will have a champion in 26 counties when this project rolls out. I don't know, does anybody else want to add? I mean, that's
That's
fairly
pretty much it. I
straightforward.
think. Yeah, I think
Yeah.
that's it.
That's it.
So I have one more question. So on post will be delivering COVID-19 information to all households. Would this initiative be able to be promoted in this way? This is from Kieran Reid. So Kieran, yes, indeed. We will be uploading posters and the flyers where you'll be able to download them and print them. Anyone that can deliver these flyers to our target group, we would be delighted, and you would, welcome to send them to the on post if they're available. Okay, the date for rolling out the project. This is from Karen Riley. So the date for the rollout of the project has yet to be confirmed, but what we're advising champions is as soon as we're in touch with you to talk about plans, etc., and contracts, you can start working on your plan once you hear back from us following this briefing session. That's it. We can't say no more. The department will give us the date for rollout, and we'll share it immediately. So, okay, so I have Pádraig Fingleton from Donegal Local Development. Great to hear of this initiative in these extraordinary times. Info just to share and encourage champions to speak to their local development companies. In Donegal, we have currently 12 staff members working on this project from our TUS, RSS, SciCap, CE and Volunteer Centre programmes, mapping and collating the information from our key community leaders, which we know through our programmes is being rolled out. Key community groups, support's been provided, identifying gaps, delivering initiatives. We hope to have developed a digital map of the county completed by the end of the week. So what can I say, Pádraig? That's your work done. Thank you very much for that piece of information. Anybody else want to comment on Donegal Local Development?
I just say that's, we need to use examples like that and spread them around the country through our network of champions. Same as what was going on in Clare. Like this is exactly what we want to replicate and make sure that people know how it's being done and know that kind of best practice that they can learn from. So good to see.
Yeah, brilliant. Okay, so this is from Brian Carty in Wicklow. Can you remind me of what are the immediate next steps we need to undertake over the next 3 days for this project? Immediate steps. So Emma?
Yeah, I would say first and foremost, like you will receive the resources, the webinar recording, all of that in the next couple of days, and a link to the webpage. I would start familiarizing yourself with the champion guide, maybe start thinking about your local action plan. I wouldn't recommend for you to get started until you get the official go ahead from us, bearing in mind that we're also kind of waiting for official go ahead from the department. So, we'll keep you updated as soon as possible, but I would definitely start maybe thinking about those initial plans, researching and starting to gather and review the materials that we're going to supply to you. And then as soon as we get the go ahead, you can start with the first step, which is that kind of audit of what's going on locally. And I think it's laid out really well in those 7 implementation steps, and it'll be in the guide that you'll receive exactly kind of what steps you should do. So first of all, starting with that local outreach plan, mapping what's happening, and then moving on to step 2, step 3, step 4. So you'll receive that, which hopefully will clarify it. And but for the time being, just I suppose making your initial plans and just kind of keeping keeping an eye on what's happening, and we will brief you as soon as possible. Maria?
Thanks, Emma.
Yeah.
Thank you. So Billy Murphy from Wexford asks, can we get guidance from the Department of Justice with regard to working with people living in direct provision who are very vulnerable on a number of levels?
Yeah, Maria,
So,
I can just say that we will be creating a resource which is all the national initiatives, including what the Irish Refugee Council are. They would be the ones, I suppose, that would be signposting from, I suppose, the Department of Justice or whatever. So they have their own COVID response, particularly for people who have refugee status or in direct provision, and they will be the people to go to for information. So that's an example of how we can signpost our champions to the right source for particular target groups, I suppose.
okay, thanks, Emma. So Caroline just comments here that grants were given out before we could give sanitising products for all organisations instead. So Caroline, I'm not really 100% sure what you're saying, but currently there isn't an extra grant system. Emma, sorry?
No, that was me coming in. Yeah, I was just going to say that there are
Yeah.
no grants in this particular version of the programme. That for people who weren't involved, the champions at one stage would have had sort of a little small pot of money, I guess, to give grants to local community organisations to host events, etc., etc. You know, have coffee mornings. That part of the programme doesn't exist on this occasion, so so that's really clear. But the issue of equipment is one that we've already taken note of, but it won't be supplied, as Emma said, as part of this programme.
Okay. Okay, so again, a question from Damien Ahern around representation on a county level. I suppose we just reiterate, currently we have 26 champions, so there is one in each county. Later during the programme, we will probably be expanding that and adding more champions within a county to cover all areas. So Damien, I hope that answers your question there. And Grania Barrel, just to note, volunteers may not need to be vetted. It depends on the role that the person is taking on. Thank you for that, Grania. And Karen Dolan, what happens next? Can you please advise on what we could do? Okay, so I think, Karen, that Emma has already covered that a couple of seconds ago. And Patricia Cassidy, from me, we are currently phoning 200 passengers a day through the local link, Louth, Meath and Fingal Carlow County Development Partnership, local development company, has established, oh yeah, sorry, I'm gone into the wrong one. Okay, so Patricia Cassidy, we are currently phoning 200 passengers a day through the local link, Louth, Meath and Fingal. That's a befriending service and checking in on them. That's brilliant, Patricia. And Mary Lawler then says that Carlow County Development Partnership has established positive relationships with over 350 vulnerable older people as part of our care and repair service. Local development companies are a key stakeholder in this COVID-19 project, as they already have relationships, networks in place and are flexible in their response. And you're right, Mary, fully agree. The plan is to bring all of those organisations in on this project and use them to disseminate this information.
Okay, Maria, we might, yeah, we're coming up on time now, so we don't want to hold people any longer than we said originally.
Yeah, I think that the last couple of things are just comments anyway, Emma, so we've gone through all of the questions. Yeah, we've answered every question.
Okay, great. And we will be, like, you know, there's numbers. I'm going to show those numbers now again. Maybe Femi, if you can give the screen back to me. I'll be sharing details, so if there's any other questions or anything, they can get in touch with myself or Lauren or Maria for any information. So if I could share my screen again. Excellent. Okay, so just a summary of what we covered today. So we did an overview of the coordinating partnership. That's the wheel and IRL, and I suppose the department as well, an overview of the project by Lauren, just how it's all going to work and how it came about, the role of the community outreach champion, and the steps necessary to implement the programme in a community, a list of the resources available and what's in the pipeline, some guideline about, just a brief guideline about dealing with media, and then the reporting methodology we will use and the metrics we will measure against. And finally, we answered your very good questions as much as we possibly could. And just a reminder then that any other questions, concerns, queries, or anything regarding the project, you can contact Maria at IRL, and you can see her phone number there. And like I said, you'll receive these slides. And there's also then the email address to log any kind of queries or concerns. So I suppose that's it really. And just to say again, a huge thank you for everybody for taking the time today and answering our call in what was a very tight time frame. So we really, really appreciate that. We're looking forward to seeing how it develops going forward. And just to say as well, I suppose, stay safe out there in what is a very challenging time, and all the best from the wheel and for IRL. So thank you and goodbye.